Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone, and welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 488. I really appreciate you joining me today. I think it's going to be a great show. Before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you would please go to my office Facebook page and like us, that would be awesome. Also, before we get started, I'd like to talk about Dentistry from the Heart. It is coming up soon. We've mentioned it almost every week for the last several. And what it is it's a free day of dentistry done at my office. It'll be June 9th, just a couple Fridays from now. And it is from 8 a.m. until 4 p.m. And what we'll do is we'll do free dentistry that day. We will do free cleanings, free exams, and free fillings. And so we could still use a couple dentists, a couple dental hygienists, some more assistants. That would be awesome. And if you want to just come out and help with registration, if you're a non-dental team member, that's okay. Come on out, help us with registration or whatever it is that we will be needing that day. And so, again, that is June 9th from 8 a.m. until 4 p.m. Okay, so for today's show, we're going to talk about my new Soleo laser and the fact that I came to Baltimore to the office of Dr. Joshua Weintraub to receive some training on what they call the UltraGuide tip, which is a way of using the laser for periodontal surgeries rather than using a scalpel blade. So first of all, Dr. Weintraub, thank you so much for being on my show.
Thank you. Glad to be here.
Now, tell me, how did you get involved with Soleo? And we'll learn a little bit more about the device in a minute, but how did you get involved?
Right. So I had a dental laser. I've been using lasers since 2009, and the laser I had before was decent. Wasn't using it that much, but it was okay. And the rep from Convergent Dental that sells Soleo, he approached me. He must have looked up who already had lasers. I'm not sure, but he asked me if I wanted to hear about Soleo, and I told him, really, look, I'm not interested. I'm not looking to spend any money, and I'm on a 12-step program for technology addicts. So
I think I should be on that program.
So I can no longer buy. I said I have to be pretty impressed to actually even consider it. And fortunately or unfortunately, and I think it's fortunately, I was very impressed. Having used lasers before, I knew what they could and could not do, so I was blown away by what this laser could do. And, I don't regret it for a second because it's amazing.
One of the things I saw in your office is this brochure, and on the outside it says, "Smile. The anxiety of going to the dentist has vanished into thin air," and it says inside, "A change for the happier." So tell me about that.
Right. So that's that's obviously a folder or a brochure that Convergent Dental produced, and it basically is trying to tell patients that they don't have to be afraid of the dentist the way they used to be. It's a new world and it's a new era and things are changing, and I'm happy to be able to offer them something that's not being offered by everybody yet, and hopefully someday will, but a laser that can do most fillings, most cavity preps without a shot and with, virtually not needing the drill. So patients don't like the shot. They don't like the feeling of the shot. They're afraid of the shot. They don't like being numb. They don't like the sound of the drill, the noise of the drill, the feeling, the vibration. I think you just described like 95% of my listeners and patients. Right, absolutely. So we're able to take, with this laser, I'm able to take away a lot of those things that people are afraid of. And then when I'm doing any kind of gum procedure, whether it's minor or major, I'm able to do it again with much less need for anesthetic and virtually no bleeding and minimal need for having to ever use sutures or stitches on a patient. And again, these are all things that make the experience and how they feel after the procedure, the day or the next day afterwards, is just incredibly better. It's just so much better for the patient.
Now, I'll have to say, and I've had mine for only a couple months now, I was a little skeptical about whether people would truly be able to have their work done without the anesthetic. And so far, only 2 people have said, go ahead and numb me. And there were a couple that said, if it had gotten any worse, I might have raised my hand and had you numb me. But I'm glad I didn't, because now we're done and I'm not numb and I get to go back to work and not drool.
Right, sure. And you may have a few patients here and there who do feel it a bit. Some patients feel nothing. Some patients feel some cold. But again, some patients, everyone's different. Some patients, don't want the cold. But that said, after the procedure, they're still happy they didn't get numb, even if they don't mind the shot, which is relatively rare. Those that don't mind the shot are still happy not to have a fat lip and tongue for a couple hours. And the other thing that's nice for the patient and the dentist is when anyone who's had a filling done knows that sometimes after the numbness wears off, that their bite doesn't feel right. And that's not, you can blame the dentist, but you can't, because we use a little marking carbon paper, and it tells us for the most part how the bite is, but all the bite has to do is be off by the tiniest bit, and it can make that tooth hurt, and it can make it uncomfortable. And so because you're numb, you can't tell how your bite is, and you got to come back to the dentist and have it adjusted. If you're not numb, that doesn't happen. You know when your bite's right, and you know better than the dentist if your bite's right.
And we probably need to clarify something, because we're talking about it as though they're not numb. But what's the truth is they really are numb, but we're able to numb them with the laser, right?
Right. So it's not the same kind of numbness. It's not an injection that causes your lip and cheek and tongue and gums to feel numb. It's more of this numbing effect where the laser, because of how it works on the tooth, is able to actually desensitize the tooth temporarily. So the tooth isn't feeling as much as it normally would. So the nerve itself is kind of
incapacitated?
Right, it's kind of knocked out.
Okay. And so, yeah, you're right. When we think of numb, we think of that numb feeling, the tingling, and we're not talking about that kind of numb. We're talking about you don't feel it, but you're not numb, right?
Correct. Absolutely. Right. So it just makes it so that tooth is just much less sensitive. So even if you do have to drill in that tooth a little bit, which again, I'll use the laser, but if I have an old silver filling in the tooth, I'll do part of the procedure with the laser, but you don't want to laser out silver, so you'll drill that part out. But the tooth has been calmed down and made to not feel as much, so you can take the drill out and take that filling out. So again, you rarely have to use a drill. There's certain cases where you will, but when you do, it's minimal. It's only a small part of the procedure.
Okay. Now, in a little bit, we're going to go back in the back, and you're going to teach us how to do this gum surgery using the laser instead of the scalpel that I'm used to using. And actually, I use a different laser, but I have a feeling it's the one you used to use, and you weren't using it enough, and now you have this better one here, the Soleo, right? So, but that I can't wait for that. And we're going to see a live demonstration on a patient, right? And then later on, you said we're going to be working on pig jaws?
Correct. Yes, you guys will be observing a live patient. This patient, we've worked in a couple other parts of his mouth. He's a fairly anxious patient. He worries about how much he's going to feel things, and you'll see. I mean, he does remarkably well, and he needs an amazingly low amount of anesthetic of the injection. Very, very little, whereas with other lasers that I've used, I have to give the patient several shots, and they're incredibly numb. With this procedure, I'm able to get the patient minimally numb with just a couple of very small injections, and they're still remarkably comfortable. And then we'll work on the pig's jaw, so all of the new users of this handpiece, this periodontal device, will learn how to use that so they can go back to their offices and give their patients this amazing service.
Okay, so let's just recap. The biggest attribute, the biggest reason you think that patients would want to have the Soleo laser used on them for both hard tissue, meaning fillings, and soft tissue, meaning gum surgery, would be?
Well, I mean, it's just a much better experience. The sound and vibration and discomfort and numb feeling and the amount of bleeding they have after certain procedures is minimized. And
let me just recap. You said sound. It's not going to sound the same. It's not going to vibrate as much. It's not going to bleed as much. It's not going to hurt as much. Was there a fifth?
Well, the other thing is after any surgical procedure, patients know that they're going to have swelling and be in pain for days at times. And with this laser, yes, for certain very invasive procedures, patients will have some pain afterwards, but it's dramatically reduced from the kind of discomfort and pain they would have after traditional surgery.
Okay, so you may want to remember what Dr. Weintraub just said, because pretty soon we're going to do Dr. Kvitko's question of the day. We're not going to do it yet, but let me just give you the phone number. You can pre-program it into your phone. It's 614-459-9769, and when it's time, you'll have a chance to win free flowers from DeSantis Florist. Okay, so I think we will do Dr. Kvitko's question of the day now, but before we do, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
And the question of the day is, according to Dr. Joshua Weintraub, patients will benefit from the use of the Soleo laser because A, there is less sound, B, there is less vibration, C, there is less bleeding, D, it doesn't hurt as much, E, there is dramatically reduced postoperative pain, or F, all of the above. All right. Again, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go! Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, my name's Athena. My family and I have been patients of Dr. Kvitko and Associates for over 10 years. We've gone to Dr. Kvitko for numerous reasons, especially cleanings, crowns, and root canals. Since going to Dr. Kvitko, I get compliments every day on how beautiful my smile is, and people always ask me how I get my teeth so white. I used to be afraid of the dentist, but Dr. Kvitko and his staff make you feel very comfortable and relaxed, and I'm not afraid anymore. I would recommend Dr. Kvitko for all your family's dental needs.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day, which was, according to Dr. Joshua Weintraub, patients will benefit from the Soleo laser because A, there's less sound, B, less vibration, C, less bleeding, D, not hurt as much, E, the postoperative pain is dramatically reduced, or F, all of the above. And we have 4 callers on the line. Dr. Weintraub, would you do me a favor? Would you pick a number between 1 and 4?
3.
Number 3. Okay, so we're going to go to caller number 3. All right, so let me ask my producer, who was caller number 3, who had the correct answer, which was F, all of the above.
Congratulations to Karen from Blacklick.
Okay, well, congratulations to our winner, and Dr. Weintraub, I want to talk to you a little bit more. I think what we might want to do now, let's go and do the surgery that you were going to talk about, where you have the live patient. We'll go do that, and then we'll talk about it after it's over, okay? Sound good?
Yeah, sounds great.
So tell us what you're going to do today.
So we're going to do the treatment with the UltraGuide handpiece with a closed flap procedure to treat some peri-implantitis by degranulating the inside of the pocket and disinfecting. And so on this patient, on Joe, we have treated a couple of other quadrants. This area has some severe inflammation around tooth number 13 and implants 14 and 15.
Okay, top left. All right. And you're going to use the Soleo Laser UltraGuide.
Correct. Yep, the Soleo UltraGuide. All right, Joe, let's take a look.
So you got them numb.
With laser dentistry, things are visual. You need to see. All right, man. So if you feel too much, let me know. So I have it. So see that? Yeah. So that means you're getting your energy out. Can you see, Doc, right there?
Are you on soft tissue only?
Yes. You can be on either. No, that was not. That was not touching. No, what? Like a couple millimeters. So what? See? Okay. So that means your energy's coming out. And now I'm starting just on the coronal portion of the pocket, and now I'm going mesial to distal as I enter the pocket, basically an L. I'm going down farther. You okay, Joe? Too much water? Joe's a little bit of a gagger, so I don't want to waterboard him too much. Just a little bit, the right amount of water. You need one last swallow, like a last meal. Close gently. You see that? I'm trying to get in there where the implant is. And I can do a little. Check your tip periodically. You don't want to force it in the tissue because it can get debris accumulating and block the tip.
That's why you work yourself down?
Yeah. Now if you can, when you're in the pocket, you actually want to push it out a little bit so you can kind of get that internal surface. So you'll see some granulomatous tissue coming out of there. Alright. You alright, Joe? You're not drowning anymore, are you? Good. Alright, there we go. And you're going to have to make several passes, so you'll see some stuff coming out, some debris. So let's see how we do here.
You're doing on the outside of the tissue to check it now?
Yeah.
It's almost like you're using it as a curette. You're almost curetting it up from the bottom up.
Right. Well, I start coronally and work my way to this one, going deeper.
So with an erbium laser, we actually want to touch bottom. Are you not necessarily trying to touch bottom here?
Yeah, normally I will. You can see a lot of stuff coming out of that one. See all that ablated tissue? And now, try a bit on the lingual. You alright? You drowning?
I'm feeling pretty good.
Need a break, sir? Drowning?
I think he's drowning.
I think it's a drowning break.
Sorry, buddy. There's much room in there.
Nope.
So, Joe, what are you feeling so far?
Fine.
You don't feel anything he's doing?
Not really.
Okay.
I had it the old way. It hurt.
You did? The other laser?
So with the Nd:YAG, it's a very hot tip. So even with a bunch of injections, you probably still felt it a bit, right?
Yeah.
Yeah. Yes. That's what I was saying earlier in the lecture. It's a nice laser, but the Nd:YAG, but it's very hard to get the patient comfortable. Close a little bit. So now we'll see. Again, this procedure is usually very, very, very fast, but this far back, and around implants in Joe's mouth, the access is just very hard in his mouth.
Is it vibrating too much?
I could just, once you use a laser enough, you'll hear.
Yeah, I heard that.
You'll hear ablation occurring.
Okay. Oh, I see. I thought it was.
You don't know what it's supposed to sound like?
Is that the good sign there?
Yeah. Right.
There's no predetermined number of passes. It's just until you have a sense that it's down at all.
Right.
So he's passing the stylus up under the gum line, going all the way to the base of what we call the sulcus to make sure he gets all of the diseased tissue, bacteria out of there.
All right. So that should about do it. How you doing, Joe?
Great.
So we're all done. How long would that have normally taken without a bunch of people watching?
Yeah, it would be probably half the time. You all right, Joe?
Yeah. You?
You having fun? Isn't it fun being at the cutting edge of dental technology?
Even if it's your edges being cut.
Right. So let's see. So now I just put a little buccal lingual pressure.
You're funny.
She only laughs at my jokes. So buccal lingual pressure. So you didn't feel much on that tongue side at all, the roof of the mouth?
Yeah.
You all right, Joe?
Yeah.
All right, Joe. Thank you very much.
Thank you.
Thank you, Joe.
Thank you.
All right, well, that was pretty cool, and you probably heard a lot of sound. You heard the suction, you heard the laser a little bit. What you didn't hear was Joe screaming or complaining or even saying a word unless he was asked a question. So tell me what you did for Joe.
Right, so what we did for Joe was, again, we got him just a little bit numb. Now, what's important to know is what we were doing was we went in. He has some periodontal disease and some inflammation, and he has some implants that are getting a little bit infected. So we went in with this laser and we clean out inside the gums where you can't see, not the outside that you can brush, but inside. We go inside and we clean out all the diseased tissue and the bacteria, and we get things healthy again. And what's amazing with this laser is I gave him very little numbing, and only numbing I gave him was on the cheek side of the teeth.
And yet you worked on the tongue side too?
Correct. So we worked on the tongue side, and he had no anesthetic there, and he was perfectly fine. I mean, I don't know if you guys heard it, but I actually stopped and asked him a few times, "Hey, Joe, how you doing? You feeling that?" And he virtually felt nothing. And with any other laser, I would have had to give him. There's no way I would have been able to do that without giving him a number of injections.
Why did you choose just to numb the outside instead of the inside? Is it more tender out there? Just you wanted to see the comparison?
Right. Well, it's partially that you want to have a little bit of numbing there. Sometimes we'll just use numbing liquid. But again, Joe's very nervous, so
Joe was nervous. He didn't look nervous.
I know. Well, we've done this a few times, so he's less nervous. But Joe, when you ask him, he says he wants to feel nothing. So that kind of patient usually is asking for you to give him a lot of injections. So, Joe could have done that without any shots, and he would have been fine, but I think he felt better just getting a little bit numb. So.
Okay, and you did some major periodontal surgery, something that typically people would have to go to a periodontist for, but you didn't need to send them to a periodontist because you have this wonderful laser with the Ultra Guide on it, which allows you to direct the laser energy exactly where you want it, right?
Correct. Yeah.
Can you explain it a little bit more than I just did?
Sure. So without using a dental laser, and especially this laser to do this procedure, the traditional way is a patient has to get very numb, and then their gums are opened up. So
opened up meaning cut?
Yeah. I didn't want.
We try not to say that, but
say that because again, periodontists do an incredible service, and they still should be seen. But I don't want to scare people away. But yes, they're cut open. The inside, and you can see the inside. So when we're using the laser, we're working inside without seeing it. But you can see inside. You're cutting away diseased tissue and cleaning the roots of the teeth. Now we do that all without opening the gums wide open. And then after that's done traditionally, you need a number of stitches put in. And so because of all that trauma, no matter how good the surgeon is, there's trauma to the tissues, trauma to the gums. You're going to get considerable swelling and have considerable pain afterwards. And the way we're able to do this without having to cut the gums wide open and without having to place stitches, the post-operative outcome, the way that patient feels that night and the next day is incredible. They just really don't usually have any significant complaints.
Okay, so this is a way to make the procedure during more comfortable and after more comfortable. And the results are probably, would you say, even better than if someone had had to use the scalpel?
Yeah, I would say they're at least as good, and in the short term, they're certainly better. If you look at that patient 1 week after I do the procedure with the laser versus 1 week after the traditional way, you can't even compare. My father's a periodontist, and I've sent him photos of some cases, and he's like, yeah, my cases don't look that good after a month, never mind after a week.
That's kind of neat. So I've been doing gum surgery since dental school. I've been doing gum surgery for over 36 years. I do have another laser that I use a lot for some of this, but it doesn't look like it would do quite as much as this one, so I'm anxious to have this one. And so you are a trainer, and me and our 5 other dentists that are here, we're going to be practicing on pig jaws under your guidance here soon. Don't know if I'll be able to get any audio of that or not. I may not, because it looks kind of messy and smelly and all that stuff. But anyway, maybe I can talk about it a little bit afterwards. But yeah, you know what? Can you hang with me, because I think we need to go to a break right now? You're listening to The Reasons We Smile with Dr. Kvitko, here with Dr. Joshua Reintrub, and we'll be right back.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, we're back. I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 488, and today we are listening to an interview I did with Dr. Joshua Weintraub in Baltimore, Maryland, and he is one of the trainers for the new Soleo laser that I have purchased and have been using now for the last 5 months. And I want to thank Dr. Weintraub, first of all, for allowing me to interview him. I know I kind of got in the way a little bit of his training session, but he was very, very gracious. So I want to talk a little bit about the laser. It's awesome, as you may have heard. I know it was a little bit hard to hear, but basically, to me, this is a game changer. It's going to allow us to do dentistry without needles, and a lot of people are afraid of needles, and they don't like the numb feeling. Now, I want to make sure that you understand that if I'm using this laser, I'm still numbing your tooth. If it's a tooth that we're fixing, meaning if it's a filling. If it's the gum surgery like Dr. Weintraub was doing, we can do minor surgeries without having to numb, but we do actually use a needle to numb the tissue a good bit. You don't have to have it be profoundly numb, like if we were using either a knife, scalpel, or an erbium laser, the ones that give off all that heat, but we do use anesthetic so that you're numb. But with the teeth, the laser is what does the numbing. We just shine that light over top of the teeth, kind of in a circle, hold it there for 30 seconds, wait 30 seconds, and then I just change the setting on the laser, on the Soleo laser. And by the way, it's the Soleo laser, S-O-L-E-A. It's not every laser. Don't confuse them, because I have 2 other lasers in the office, and neither of them allow me to do this type of dentistry without needles. But the Soleo laser does. Now, there have only been about 300 of these sold in the entire United States. So it's new technology, it's the latest and greatest, and I really believe it's a game changer. So the big advantage then is while your tooth was numb, while I was working on it, your lip is not numb, your tongue is not numb, your gums are not numb. You don't have to go back to work or back to school with, feeling like you're drooling or something. It's really, really neat. You should check it out. And if you're interested in giving it a try, give the office a call. I don't usually actually plug the office this way on a show, but for this, I think I'm going to make an exception. My office number is 614-262-9588, and we have a location in Clintonville and one in Upper Arlington. So yeah, feel free to give us a call if you want to try out this newest, latest, and greatest technology. Okay, well that looks like that's all the time we have. Don't forget to follow me on Twitter at Dr. Kvitko, and go to my office Facebook page and like us. It's Dr. Kvitko and Associates. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588. 262-9588 or send an email to speaking@thereasonswesmile.com.